In this video, we're going to talk about steps to fix a buried penis. So there's really a lack of awareness out there about what a buried penis is and, more importantly, what can be done for it. Usually when I see folks that have this problem, they've been suffering from it for years, and oftentimes they've been visiting with their primary care doc or maybe even a urologist and not really getting too much help. So the type of folks who usually suffer from this are folks who tend to gather their weight in the pubic area. Just because of their genetics, that's where the weight distributes. And more typically, it's folks who've lost a lot of weight, especially massive weight loss after, let's say, a gastric bypass, or new medications like Ozempic are allowing people to lose a massive amount of weight. So we're seeing it a lot more commonly. And what happens is pretty much a telescoping type situation, where as the abdomen and the pubic area deflate, the loose skin sinks down and engulfs the male anatomy. And this can cause all sorts of functional problems, difficulty urinating, chronic infections. If the patient has a foreskin, it can aggravate phimosis or tightness and infection of the foreskin area, and of course sexual problems as well. And the solution here is usually three parts. We're usually doing three things at these surgeries in order to fix it. So when I see the patient, I'm going to assess them at what their goals are. What is the most important thing? Is it mainly functional, or are there some aesthetic aspects to it? And this is one of those types of plastic surgeries I absolutely love, where it's a combination of both usually. And so we can do a full tummy tuck if the patient wants to do that. The recovery is a little bit longer at the same time as we lift the pubic area, or more commonly, folks will do like a mini kind of pubic lift or monsplasty and get rid of the tissue there. But typically the first step is to get rid of the fat. So oftentimes we'll do liposuction of that pubic area, and oftentimes we'll get a decent amount out, because like I said, folks who suffer from this condition tend to hold a lot of their weight just there in the pubic area. So first thing is we're going to empty the anatomy out. If we want to do liposuction in the flanks or somewhere else, we'll do that at that point. And then after that, we're going to do the monsplasty, where we lift up and get rid of the extra tissue that's there. Now, the third step of that surgery is to check for looseness of the skin, because one of the problems here anatomically is that the skin is not very adherent to the penis, so it's allowed to slide down. So typically we'll put some good strong stitches in there in the front, and then we look underneath and see what the situation is where the penis meets the scrotum, and whether we need some extra stitches in there or not. This is a really gratifying procedure. Usually the downtime from it is about 2 weeks off work typically, and usually about 6 to 8 weeks off heavy lifting or working out.